Welcome to the Georgia Occupational Therapy Association's YouTube channel. This video is a sneak peek of the members-only content. The GOTA YouTube channel launched just over a month ago. In that time, the membership committee has been busy creating content for members. Thank you to everyone who completed the YouTube channel survey at conference, sent the membership committee emails, and approached committee members to suggest video topics. We produce content based on your requests. Members are the only viewers who have access to all videos produced by the membership committee and posted to the YouTube channel. To access content, members must log into their GOTA.com membership profile. After logging in, click on the Resources tab and select the GOTA YouTube channel from that drop-down menu. Once you navigate to the YouTube channel page of the GOTA website, you will have access to the channel's mission statement, instructions for any member wanting to produce content, and to each video. To access the YouTube channel content, click on the tile representing the topic you are interested in watching. Once you click the tile, the YouTube video will automatically play. Here is a snippet of the current content available to GOTA members. We currently have 9 members-only videos and 2 public videos. We currently have 1 lecture, 1 group discussion, 3 back-to-basic videos, and 3 quiz videos. The 9 member-only videos include the successful chronic disease self-management among racial and ethnic minority populations, where gerontology and OT meet, from Dr. Mingo from Georgia State University. The Atlanta region group discussion following Dr. Mingo's presentation. Back to Basic video series. First video covering slide board transfers, squat pivot transfers, and depression transfers. The second Back to Basics transfer video covering tub transfers from wheelchair and with a walker. Back to Basics myotomes, showcasing the helpful jingle to remember the myotomes. We also have the Family and Medical Leave Act video covering FMLA history, what the FMLA is, who is covered, who's eligible, details of leave, and things to remember. The video concludes with topics that could hurt you if you're unaware of them, and scenarios to review. Finally, we have 3 quiz videos covering child milestones, bones, and subluxation. Here's a sneak peek of our subluxation quiz. Name at least 3 common causes of neuromuscular subluxations. Three common causes of neuromuscular subluxations include stroke, cerebral palsy, brachial plexus injury. Common treatment for a traumatic shoulder subluxation. The treatment for a traumatic shoulder subluxation includes ice to reduce the swelling, avoiding postures leading to recurrent subluxation, and wearing a protective sling. If pain occurs, medications can be used. The patient should also start passive or active range of motion exercises for the upper limb and scapular stabilization exercises. If these interventions are tolerated, the patient should progress to strengthening of the shoulder girdle muscles and glenohumeral joint proceptive training to improve stability. Here's a sneak peek of our FMLA video.
So what exactly does the leave entail? The Family Medical Leave Act allows eligible employees from covered organizations to take up to 12 work weeks leave in a 12-month period. This leave can be taken all at once, divided into weeks, or applied to an adjusted work week. Employees can take leave for any of the following reasons: the birth of a child, placement of a son or daughter for adoption or foster care, for serious health conditions preventing the employee from completing essential functions of his or her job, which can include health services to address the employee's needs, to care for a spouse, son, daughter, or parent who has a serious health condition. Let's move into some scenarios. Let's say a full-time CODA is at her company for 10 months and is requesting FMLA coverage. Is she eligible to have her job protected by the FMLA? No, only employees who are full-time for 12 months or who have worked a cumulative 1,250 hours are eligible.
Now, let's take a sneak peek of our transfer video.
Hey GOTA members, so we've made a couple transfer videos to post onto the YouTube channel. We just wanted to share some tips and tricks for how to keep your own body safe as well as helping your patient be successful with that transfer. So in this video, we're going to go over a slide board transfer, a squat pivot transfer, and a stand pivot transfer, as well as some tips and tricks for dependent transfer.
So the next transfer we're going to go over is a stand pivot transfer. So we already have our setup of where we want to go. We're going to put our gait belt on, so we're ready. Again, this gait belt is much too large. And then we want to make sure we have our brakes locked. And that's something you can start practicing with your patients too, that they know to lock the brakes. And then you're going to look around to see what else you have in your way that might get in the way of your transfer. So you might have a catheter bag or a Foley bag. So just thinking about where that is. If it was over on this side, then we might get tangled up. So getting that where it's hanging on the walker and free of the direction we're transferring. If you have an IV pole, if you had it over on this side, you have to think about what arm it's in. So if it's in this arm, and then we would put the pole so that there wouldn't be any lines or kinks in it as we're transferring. So if the pole or the IV was in this arm, then I want the pole to be over here because I'd want it where we're going to end up. So just taking the time to think through some of that before you do the transfer.
Welcome to the sneak peek of our child milestone quiz. At what age do babies start to hold their heads up and begin to push up when laying on their stomach? By 2 months old, a baby should start to hold their head up and begin to push up when lying on their stomach. By what age should a baby be able to walk alone? By 18 months old or 1.5 years, a baby should walk alone. Up next, a sneak peek of our myotome video.
You put your C1 in, you put your C2 out, you put your C1 in and you shake it all about. You do the myotomes and you turn yourself around. That's what it's all about.
And now, a sneak peek of our bones quiz. What type of finger fracture results in a mallet finger? Proximal phalanx fracture, middle phalanx fracture, or distal phalanx fracture? A distal phalanx fracture results in a mallet finger. A mallet finger is where the end of the finger is bent or flexed toward the palm and can't straighten. A mallet injury occurs when an injury tears the tendon from the end of the finger. Instead of surgery, treatment involves keeping the distal joint straight for 6 weeks to help the tendon heal. The splint should be small enough to keep only the most distal joint straight. Thanks for viewing our sneak peek video. If you aren't a member, become one. Your first year of Georgia Occupational Therapy Association membership is only $45. Already a member? Consider creating content. Navigate to gaota.com, the YouTube channel page, for instructions on how to create content. We welcome feedback. Comment below. Thanks for tuning in.